Your nose is not just for smelling, it is part of your breathing system. Every day, air passes through it before reaching your throat and lungs. But modern wellness culture has turned one simple fact into a dangerous shortcut. If nose breathing is useful, then taping the mouth must fix sleep. That conclusion is too simple. Mouth taping has become a viral health trend. People claim it improves sleep, stops snoring, sharpens the jawline, boosts oxygen, and changes the face. But the Feynman question is simple. What problem are we solving, and is tape actually solving it? Before discussing tape, understand the nose. Why would the body place this complicated structure in front of the lungs? Why not breathe through the mouth all the time? The answer is that the nose prepares air before it travels deeper into the respiratory system. Think of your nose as a biological air conditioner. Incoming air may be cold, dry, dusty, or irritating. The nasal passages help warm and humidify that air before it reaches more delicate tissues. Your nose is not a decorative tunnel. It is a conditioning chamber. Your nose also helps filter. Tiny hairs, mucus, and the mucociliary system help trap and move unwanted particles. This does not make your nose a perfect shield against every pollutant or infection, but it does mean nasal breathing gives incoming air preparation step that mouth breathing largely skips. Your mouth is important. You use it to speak, eat, drink, and breathe when airflow through the nose is limited. Mouth breathing is not evil. It can be necessary during intense exercise, nasal congestion, or illness. The problem begins when mouth breathing becomes a default, especially during sleep. When you breathe through your mouth at night, the mouth can become dry. That can contribute to discomfort, bad breath, and waking thirsty. But dryness is a clue, not a complete diagnosis. It tells you something about your breathing pattern. It does not tell you the cause by itself. Some people breathe through the mouth because the nose is blocked. Allergies, colds, sinus problems, nasal polyps, structural issues, and inflammation can all make nasal breathing harder. If the road is blocked, taping the exit does not fix the road. This is the danger of the trend. If someone cannot breathe well through the nose, forcing the mouth closed can create distress. A wellness hack becomes risky when it ignores anatomy. The correct question is not, can I tape my mouth? The correct question is, why am my mouth breathing? Snoring is not always harmless. Sometimes it is simply annoying. Sometimes it points toward airway obstruction during sleep. The sound happens because airflow vibrates tissues in the upper airway. The body is telling you that breathing during sleep may not be as smooth as it should be. Obstructive sleep apnea happens when the upper airway becomes blocked repeatedly during sleep. Breathing can reduce or stop. Oxygen may drop, and the body may repeatedly wake enough to reopen the airway. A person may not remember these awakenings, but the body still experiences them. If someone tells you that you gasp, choke, or stop breathing during sleep, do not treat it as a personality flaw or motivation issue. That is a breathing signal. Persistent loud snoring, witness pauses in breathing, and daytime sleepiness deserve proper medical evaluation. A mouth tape strip may reduce visible mouth opening. But hiding the symptom is not the same as solving the cause. If snoring or sleep apnea is present, the goal is not to silence the mouth. The goal is to understand the airway. Some viral videos claim mouth taping will reshape the adult face or create a sharp jawline. Be careful. A simple strip of tape is not facial reconstruction. Breathing patterns can matter, especially during growth and development, but adult face shape claims online are often exaggerated. Mouth breathing in children deserves attention because sleep, growth, behavior, and airway development can be connected. But children should not be treated with social media experiments. Persistent mouth breathing, snoring, or restless sleep should be discussed with a qualified healthcare professional. The nose also relates to nitric oxide, a gas produced in the nasal passages and sinuses. Nitric oxide has biological roles, including effects on blood vessels and airways. This is real physiology, but it should not be turned into a miracle slogan. The internet loves to find one molecule and make it responsible for everything. Nitric oxide matters, but it is not a magic explanation for every sleep problem, athletic result, anxiety symptom, or facial change. Biology is a network, not a single button. During easy movement, many people can breathe through the nose. As intensity rises, mouth breathing may become necessary because the body needs more airflow. This is normal. A good breathing strategy should fit the situation. Forcing nasal breathing during every effort is not automatically smarter. A practical rule is simple. During moderate activity, breathing becomes faster, but you can still speak. The goal is not to win a nasal breathing competition. The goal is to move safely and build fitness. Your body can use different breathing routes depending on demand. Sleep breathing is affected by more than the mouth. Sleeping position, alcohol, congestion, body weight, medications, nasal anatomy, throat anatomy, and sleep quality can all matter. A strip of tape cannot replace a complete look at the pattern. Alcohol can relax muscles and worsen snoring or obstructive breathing in some people. If someone snores heavily after drinking, that is useful information. The answer is not simply to tape the mouth. The answer is to understand what makes the airway more likely to collapse or vibrate. Sleeping on the back can worsen snoring or airway obstruction in some people. Side sleeping may help certain individuals. This does not cure every sleep problem, but it shows a larger lesson. Airway mechanics matter. Some safer approaches focus on improving nasal airflow rather than sealing the mouth. Treating congestion, using nasal saline, managing allergies, or using nasal strips may help certain people. The correct option depends on the reason breathing through the nose is difficult. If someone has sleep apnea, CPAP, or another prescribed treatment is not a failure. It is a tool that helps keep the airway open. The goal is not to look natural on social media. The goal is to breathe properly during sleep. The wellness industry sells simple answers because simple answers are easy to market. Tape your mouth. Fix your sleep. Fix your face. Fix your energy. But the airway is not a slogan. It is anatomy, physiology, behavior, and sometimes medicine. The first step is observation. Do you wake with dry mouth? Do you snore? Has someone noticed pauses in breathing? Do you wake tired after a full night in bed? Do you have nasal blockage? These clues help identify the real problem instead of chasing a viral solution. Do not diagnose yourself with sleep apnea from one video. Do not dismiss sleep apnea because you are young or thin. Do not assume snoring is harmless. Do not assume every dry mouth means danger. Persistent symptoms deserve careful evaluation. Daytime sleepiness is not always laziness. It can reflect poor sleep quality, insufficient sleep, sleep apnea, medication effects, stress, or other health issues. If your body is repeatedly asking for sleep during the day, pay attention to the signal. Some people with sleep-disordered breathing report morning headaches or unrefreshing sleep. These symptoms are not specific enough to diagnose the cause alone, but when combined with snoring, gasping, and daytime sleepiness, they become important clues. A safer experiment begins while awake. Sit comfortably. Close the mouth gently. Breathe through the nose if it feels easy. Notice whether air moves freely. If you feel blocked, strained, panicked, or short breath, the lesson is not to force it. The lesson is to investigate why. Slow breathing can help some people settle the nervous system, but slow breathing is not the same as taping the mouth during sleep. One is a conscious practice you can stop anytime. The other removes a breathing route while you are unconscious. During the day, you can practice nasal breathing gently when it is comfortable. Walk slowly. Breathe through the nose. Notice posture. Notice congestion. The goal is awareness, not force. Breathing training should make the body feel more capable, not trapped. Improve the sleep environment. Keep the room comfortable. Reduce late scrolling. Avoid heavy alcohol close to bedtime. Manage allergies where appropriate. Sleep on your side if it helps. These habits are not flashy, but they often matter more than a viral strip of tape. Try a 7-day observation experiment. Do not tape your mouth. Instead, track dry mouth, snoring reports, nasal blockage, daytime sleepiness, alcohol timing, sleeping position, and screen use before bed. The goal is not to perform a hack. The goal is to understand the pattern. Seek medical advice when loud snoring is persistent, when someone notices pauses in breathing, when you wake gasping or choking, when daytime sleepiness affects life, or when sleep never feels restorative. These are not problems to solve with tape from a drawer. Do not use mouth tape on children because of a trend. Children cannot be treated like miniature wellness experiments. Snoring, mouth breathing, restless sleep, or behavioral changes should be discussed with a clinician who can evaluate the airway and overall health. Do not tape the mouth when the nose is congested, blocked, or unreliable. Do not use it with breathing disorders, sleep apnea, nausea risk, heavy alcohol use, sedatives, or anxiety around breathing. A technique that restricts a route of airflow should never be casual. Here is a Feynman test. Can you explain the issue in one sentence? Try this. Nasal breathing prepares air before it reaches the lungs. But mouth taping does not fix the reason someone is mouth breathing, snoring, or struggling to breathe during sleep. The best analogy is a road system. The nose is a preferred road for quiet sleep breathing. The mouth is an emergency exit. If the preferred road is blocked, do not lock the exit. Find out why the road is blocked and fix the real problem. Your nose is not just for smelling. It warms, filters, humidifies, and helps prepare the air you breathe. Respect that system. Support nasal airflow when appropriate. But do not confuse a viral tape trend with medical care. Better breathing begins with understanding the airway, not sealing the mouth.